Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Experiencing occasional anxiety is a normal part of life, but for people with anxiety disorders, intense, excessive feelings of fear, worry, terror, or panic can affect their quality of life. Whatever form of anxiety you have, treatment can help. Our guest today is Dr. Umesh Vyas. He is a psychiatrist and sleep medicine specialist at Mayo Clinic Health System. Dr. Vyas, thanks for joining us today.
You are welcome, Jason. Thank you. Thanks for having me.
Well, let's start out by defining what exactly is anxiety and what is an anxiety disorder.
Anxiety is characterized by anxious thoughts, physical sensations, and behaviors caused by perception of a threat. A threat can be obvious, such as upcoming public speaking. You need to give a speech in front of your boss or in your department. Or fear can be physically assaulted again, because you had one incident in the past and now you had another, and that's an obvious threat. Everyone experiences anxiety. Anxiety is a normal, a healthy process. And I can give a couple examples. When you about to cross the road, you look both sides just to make sure that I'm okay, no traffic is coming in, and it's safe to do so. Why? Because you have a fear that if I will not look around, I might get hit and this can be unsafe. So this is a normal anxiety. The anxiety disorder is a disorder where anxiety is overwhelming, it is excessive, and excessive to the point where it starts impacting or affecting your quality of life in one or another way.
So, for example, I am afraid of heights. That doesn't necessarily mean I have an anxiety disorder. When it comes to heights, it just means that I may be anxious or have anxiety when it comes to heights. But when it starts affecting where I don't want to go up tall buildings, or it affects my quality of life, you're saying that is a disorder then?
Yes, absolutely. As long as you are functional. So if you get a job on a 17th floor in Manhattan, and as long as you take elevator every day and you go up a stair and you perform your duties, this is a normal anxiety. Same thing, I can give you another example. If somebody has a germophobia, it is normal to wash your hand before your mealtime. Mm-hmm. But it is not okay to keep washing hand over and over. You already washed it twice, and now you again go there and wash one more time just to make sure that there is no germs left on your hand, and it starts affecting your skin because of your overuse of soap and water.
So we talked about a couple of phobias right there, so germophobia and also the fear of heights. I know there are many anxiety disorders. So can you give some examples of some of the most common anxiety disorders that you help patients with?
One is the generalized anxiety disorder. Generalized anxiety disorder is a type of the disorder where basically patient has anxiety, a fear for anything, everything. Their life in general, health, work, family, house, transportation, anything, everything they are basically worried about. Mm-hmm. So that's a generalized anxiety disorder. Another disorder is obsessive compulsive disorder, where person has an obsession. And I can give you an example. Keeping everything in order. That's a kind of an obsession. They put everything in order, and a little 1 millimeter something on this side or this side is not okay to them, and they just keep putting everything in order over and over. Because of the obsession, they have to have some compulsion. So if somebody has a fear of contamination, if they don't wash their hand, they have an intense anxiety inside. To ward off that anxiety, they have to go and wash their hand, or they have to take a shower, and they may be taking 20 times a shower in a day.
Which is not normal.
Which is again not normal.
Right.
So someone who has obsessive compulsive disorder typically what happens is that they have some obsession. Obsession causes anxiety, and to ward off that anxiety, they have some compulsion. And then once they do the compulsion, the obsession, the anxiety goes down, but that does not, it stays like that. And again, they build another, anxiety, they have obsession, and they have a compulsion. The panic disorder is a disorder where they have an intense, excessive anxiety like an attack. It comes in few seconds, stays for a few minutes, and it is like a impending doom, kind of a fear of, the dying kind of a situation.
And that's what many people call panic attack.
Panic attack, exactly. Then another disorder is called post-traumatic stress disorder, where person either have had or they have witnessed having some disaster. It might be a natural disaster or accident or some traumatic event. I'll just give you an example. Someone who was a part of World War II, they don't want to watch a movie with the war situation. That's called avoidance. They have intrusive thoughts of those incidences. Basically, they live in that situation. They may have a nightmare. In the sleep, they are basically visualizing exactly what has happened during the actual event of a trauma. Another disorder is a social phobia, where patient has an extreme anxiety to face with the social situation. And because of that, they basically avoid the social situation. They don't want to go to the parties. They don't want to go outside in a social situation because they have a fear of embarrassment and rejection. Another phobia is a specific phobia, like having a little fear of a dog, snake, or a spider is normal. But just by looking at a picture of a snake and you are afraid, that's not normal. So there are many specific phobias. Phobia towards blood, phobia towards injection, height, closed space, that is called claustrophobia. So these are some of the examples of specific phobia. There is another disorder called separation anxiety, which is very typical in young children. They basically have anxiety symptoms because of the fear of separation from the parents.
So let's talk about symptoms. So what are some common symptoms of anxiety disorders, and are there common symptoms?
Yes, there are some of the symptoms are very common, like having a fear for anything, everything, shortness of breath, sweating, trembling, shaking, rapid heart, chest discomfort, feeling of like a choking or smothering, tingling sensation, dizziness, nausea, vomiting, diarrhea, fear of losing a mind, dying or fainting, sense of unreality, sense of impending doom.
Dr. Vyas, do we know what is the primary cause of anxiety disorders?
Well, the exact cause of anxiety is not fully understood. There are several theories. There are several risk factors may cause or may put someone at a little higher risk than others. One is biochemical theory. Basically, it is because of some chemical imbalance in the brain. Some of the biochemicals like serotonin, norepinephrine, dopamine. Then the second theory is called learned theory. If somebody is exposed to an assault at a younger age or any age, there is a little risk that they may have some anxiety disorder because of that traumatic event.
So when should someone seek help, medical help, for anxiety?
The bottom line for anxiety disorder is a patient should seek help anytime when they start realizing that it is affecting their quality of life. Any patient who is experiencing anxiety may benefit from their medical evaluation. Anxiety does not mean that they have anxiety because of a psychiatric reason. Patient who has a mitral valve prolapse, they may feel some shortness of breath and some chest discomfort, or somebody who has some respiratory problem or other medical problem. Before somebody given a diagnosis of psychiatric disorder, they do need some medical evaluation just to make sure that they don't have underlying medical reason which is untreated, not diagnosed. So that the treatment, or I would say the evaluation, starts from there, and then if nothing is found, then the next step is the psychiatric evaluation. Mood disorders and anxiety disorders, they go hand by hand. So it is very common for these patients to have some symptoms of depression. They may develop suicidal thoughts and ideations just because they are so frustrated and they don't know what to do. Or somebody may start using substances such as alcohol, street drugs, or they may start using some type of the medications which typically we use for the treatment, but they are addicting and they start using more than they should be using. These are some of the indications that they might be dealing with the anxiety, and they are using it more than they should be because to treat their anxiety.
And when you say affects their quality of life, so that means they're not able to function well at work, at home, at school, they may not sleep well, those types of things, right?
Exactly. I'll just give you an example. Somebody is driving on a bridge. Bridge collapsed. I'm not saying that they were part of it. They were just about to enter on a bridge. They witnessed everything and they develop a panic attack. Now this person is afraid to the point that does not want to get into the car, does not want to get out of the house, and they are basically, or that person is pretty much homebound because of the attack they had at that time because of what they witnessed.
So as a psychiatrist, how do you help folks in the treatment of anxiety disorders?
In psychiatry, the treatment plan is a biopsychosocial model, where bio is use of medications or pharmacological intervention. Psycho is basically a psychotherapy, and the social part is some social situation. The treatment plan in psychiatry is multidisciplinary, where the psychiatrist, therapist, and social worker, they basically put together and make a treatment plan. In event of somebody who has anxiety disorder, they may need some medication management. As far as a different type of the therapies is concerned, cognitive behavioral therapy, relaxation therapy, exposure response prevention therapy, flooding, desensitization therapy. These are some of the type of the therapy we use. It all depends on the type of the disorder. I can give you a little example. Somebody who had a panic attack does not want to go out and they became homebound. What would be the best therapy for that patient? Maybe desensitization. First day, they just open the front door, look outside, come back. They may have an intense anxiety to deal with even just opening a door and looking outside. Maybe after 2 days of practicing that, may be able to go 2 steps outside their house. Maybe after that, 5 steps outside the house. Maybe the next step is just walking around their house, make a 1 round, come back. The point I'm trying to make is that it's like a gradual process. You are basically desensitizing yourself to the situation and making a little progress at a time.
Fantastic. Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. Umesh Vyas, Mayo Clinic Health System psychiatrist, for joining us today on Speaking of Health. Thank you, sir.
Thank you.
Have a great day, everyone, and be healthy.